We acknowledge the lands of the traditional custodians across country.
From the Noongar peoples in the west to the Kulin and Kurnai nations of the south and the clans of Nipaluna.
To the Ngunnawal peoples and the Sunrise peoples of the Gadigal and Wurrumai of the east. To the Yagara, Turrbal and Bindal peoples of the north.
And we pay our deep respects to them, to their wisdom keepers of the past, to the knowledge holders and seekers of today, and our future custodians.
Our lands nurture us as we continue the connection and our spirituality with country.
Good evening, everyone, and welcome to the 2023 Brilliant Women in Digital Health Awards. Welcome to everyone who is joining us from here in Sydney, where I'm located, and our Melbourne Consumer Insight Centre, and to everyone online, welcome. I too would like to acknowledge the Gadigal people of the Eora Nation, the lands on which we're located today here in Sydney, and pay my respects to elders past, present and emerging, and despite the result of the referendum on the weekend, confirm our ongoing support for reconciliation with our First Nations people. The Brilliant Women in Digital Health Awards aims to recognise and honour women for their contributions to and their achievements in digital health across the health and aged care sectors. The importance of these awards, I believe, has three foundational elements. Number one, recognising women who operate in the STEM space, and women, as we know, are often underrepresented in this area. The second most important reason for the awards, recognising the criticality of digital solutions to transform our health system. System connectivity and integration is the holy grail in healthcare, and we must continue to strive to make it a reality. But I can't find anyone around the world who has achieved that yet. And number three, through this digital transformation of healthcare, we have the ability to change the lives, the health and the well-being of so many Australians. And in my mind, that's the most worthy pursuit. So this marks the third year of our Telstra Health Awards program. In both 2021 and 2022, we celebrated the achievements of 25 remarkable award recipients. This demonstrates to me there are so many talented women operating in the digital space. The 2023 awards, we saw some fine-tuning that we made to assess the candidates according to 5 categories. This, in my mind, reflects the breadth and diversity of digital initiatives, while still acknowledging the individuals who have gone above and beyond their professional duties. The 5 award categories that we'll be giving recipients tonight: 1, advancing medical research through technology; 2, contribution to developing new digital health products or technologies; 3, achieving health outcomes using health technology; 4, for contribution to growth, maturation and commercialisation of the digital health sector through innovation, leadership and advocacy. And the final and 5th category, introducing a new digital process to improve clinical and patient experiences in either health or aged care. We couldn't have an awards night also without a special judges category, and the Judges' Choice Award recognises outstanding contributions and achievements in the sector. And whilst talking about our judges, it's a tough ask of them, and they dedicate their time with enthusiasm and commitment. So I'd like to thank our 4 judges for their careful consideration of the awards this year. Professor Jane Holton, AO PSM, Dr Steve Hambledon, AM, Dr Louise Shaper, and Professor Nairi Brown. Thank you so much for your ongoing commitment to the awards program. Now, the important thing, giving out the awards. So I would like to welcome our keynote speaker to help me with the award distribution. And Dr Jess Gallagher will come on the stage in Melbourne to help me recognise our 2023 award recipients. And after the awards are given, we'll be hearing from Jess. So if I could ask you to welcome Jess to the stage now. Thanks, Jess. And now it gives me great pleasure to announce our 2023 Brilliant Women in Digital Health Award recipients. As I invite our award recipients to the stage, I'll ask them to share what they hope their legacy will be, professionally or personally. And you don't need to thank all your family members for all you've achieved, because there are a few award recipients. So, without further ado, category number 1, introducing a new digital process to improve clinician and patient experiences in health and aged care. Please join me in congratulating the CEO and founder of Souped Up, Belinda Adams. Congratulations.
Congratulations. Well done. There you go.
Long road, got a ways to go. Took a big step, but you're not alone. 'Cause we got each
other. I'd first like to congratulate all the other winners that are here with us tonight and online. I'm honoured to be included in such an amazing cohort of brilliant women doing brilliant things. I'd like to extend a special thank you to Telstra Health for the awards and for acknowledging promoting women in digital health. To Alicia for nominating me for this award, thank you very much. To my son Harry, patience and support his mum is unwavering. To those here tonight and watching online for their support, and a special thank you to my colleagues and team at Souped Up, whose collaboration and dedication has led to our collective success. Without them, I would not be standing here today accepting this award. I hope my legacy is a positive one. Innovation and technology are indispensable tools in enhancing the quality of care, particularly in the realms of food and nutrition. I hope in some small way I help make the lives of those who work in care or those who receive care that little bit better.
Thanks, Belinda. Our second award in the category of contributing to the development of a new digital health product or technology, it is with great pleasure we recognise Associate Professor, RMIT School of Computing Technologies, Sonika Tahiti.
This is for my team. I know some of you are watching online. This is yours entirely. And thank you for this opportunity and for my 2 women leaders at RMIT University, Karen Butler-Henderson and Karen Wersipur. Thank you for encouraging me to apply for this award. So for legacy, I think if I may, talk on behalf of all of the digital health practitioner community is that the legacy that I would like us to leave behind will be to empower individuals to have better quality of life, better wellness, transform healthcare in a way that it has a long-lasting impact for generations to come. I think we have this power with access to various kind of data and access to technology. So I feel very powerful and very fortunate. Oh, what a time to be alive, and I hope we can make that positive impact. I would also like to say personally, I hope I can inspire other women to dare to be first. So I'm the first girl in my family who have had a PhD, who traveled overseas on her own. And I also happen to be the first one to get PhD in my discipline from my university. And when I was choosing this career in science and technology, I didn't have other people like me to look up to. So I had to carve my own path. And I know my mom and dad are watching this. So Mummy and Papaji, thank you so much for having faith in me and for supporting me all the way. I'm standing here all because of you. And thank you to my husband, my two beautiful daughters, and you are my forever strength. And thank you to all of you to be here and encouraging us. Thank you.
Thank you, Sonika.
Beautiful words.
Our third award. Now, this was where it gets a bit tricky too, because our judges thought two women were equally deserving of recognition in the category of achieving outcomes using technology. So what I'd like to do first is ask you to give a big round of applause to the Hospital Manager of Virtual Care, Mackay Hospital and Health Service, Kathy Lariviere.
Thank you. I'm very grateful and honoured to be here. I'm very nervous, as you can forgive me. I truly believe that if we are going to succeed in the face of the challenges we see in today's health services and health system, we must learn to combine best clinical practice with the smartest business strategies and workflows. And we must do this as we unify our public and private sectors to operate as one health system. This has been my vision and my passion over the past 9 years, to prove that this is possible. And I'm pleased to say that one of our virtual programs in Mackay is a very successful telehealth model that operates as a public-private partnership arrangement. I've presented this model at conferences, and I often include some innovative quotes in my slides. And after my most recent presentation, I received an email from someone who had seen it, and their email said, and I quote, "I love the quote, if you want something new, you have to stop doing something old." That's what you did. You opened the medical world to a new and efficient level of patient care. So I guess that's what I hope for, to show what's possible and for Mackay Hospital and Health Service to be known as a place where things get done, where things get real. I'd like to finish with another quote I heard recently, and I just shared it with my wonderful team this week. And like the rest of you, that we can't do this without our team and the wonderful people around us. And that quote says, "The quickest way to succeed is to start now and figure it out as you go. You can't learn to drive a car you can't learn to drive in a parked car." Thank you.
Beautiful words. And the co-winner of the award for achieving health outcomes using technology, the Head of Youth Mental Health, Telethon Kids Institute, Dr Yael Perry. Dr Perry is unable to be with us, but I understand has joined us online. And Dr Perry describes herself as a researcher who aims to harness the power of digital technology to improve the mental health of marginalised youth. And one of the best parts of her job is mentoring students and junior researchers. She co-designed a digital game to prevent depression in young people. And she hopes that we can strike a balance between the unique benefits of digital health while maintaining the irreplaceable contribution of human connection that supports optimal health. So congratulations, Dr Perry. I must admit, it's feeling like a very Melbourne-centric evening, but that's all right. We're not going to get competitive with you guys down there. The next award category, I'd like you to join me in congratulating someone who has truly earned their place in the spotlight in the category of contributing to the growth, maturation and commercialisation of the digital health sector through innovation, leadership, support and advocacy. So if we could recognise Vice President Strategy and Business Development iCare World Australia, Dr Kate Taylor.
Thank you, Jess. Thank you, Elizabeth, and thank you, Telstra Health. It is a wonderful honour, as my colleagues have said. I want to really also thank my truly brilliant colleagues and my friends, including Janine, who nominated me, and my family, who made this journey possible. A legacy question is tough when you're 50-something, but I have actually been asked it before by my brother in a downtown bar in New York late at night, and I remember the answer. I said there were three things. The first thing was I wanted to have a family who loved me and loved each other as much as I loved my own. The second thing was I wanted to have dear friends who remembered my dinner parties. And the third thing was to make a difference in the world. And really concentrating on that third thing, it's around innovation and health. And the purpose of that is obviously people and patients' lives. And for me, it's about eye care. And it's about how do you increase the affordability, the accessibility, the equity and the quality of healthcare. So we did that with Oculo, which set up an interoperable platform designed to connect optometry and ophthalmology so that the data could travel and the patient didn't have to, or if they did, people could make the right decisions and you improve the continuity of care and the quality of patient outcomes. And we're doing that today, building on Oculo with an AI-powered diabetic retinopathy screening platform. And that really matters because if you detect diabetic eye disease early, you can prevent 97% of that vision loss. But today, 50% in many parts of the world, much more than 50% of people with diabetes don't get their recommended eye checks. So they're not getting that chance to protect their vision. And similarly with glaucoma, more than 50% of people who have glaucoma don't know it. So screening really matters. Technology can make a huge difference bringing care where there has not been enough care or any care. And we have a lot to do. And I really hope my legacy is still a long way off. Thank you.
Next award. We're shifting to Sydney, you'll be pleased to know. Advancing Medical Research Through Technology category. A big round of applause to Postdoctoral Research Fellow, Sydney Health Literacy Lab, School of Public Health, the University of Sydney, Dr Julie Eyre.
All my life
Hi everyone. I also want to thank my colleagues and my team, my family and my partner Paul as well, and Steph and Anna who nominated me. I work in the area of health literacy research, and we see time and time again that health information tends to be written in a way that's quite difficult for people to understand. And it's not that it needs to be written in that, it's not that it needs to be conveyed in that way, it's often much more complex than it needs to be. So what I hope, in terms of my legacy, what I'm hoping that my research achieves is that people understand. Oh, sorry, I was going to say something else first. Just a bit nervous. Yeah, so the reason why it's important that information is written in a more simple way is that it's a big issue for patient safety. It's also really important for accessible and inclusive healthcare, and more we're seeing that it's important for combating misinformation as well, which we really saw during the pandemic. So that all kind of leads to why I'm so interested and passionate in this area of research. I really want people to understand why health literacy is important. I want to be able to give people ways to advocate for evidence-based strategies that a health service can use to better meet community needs. And I'm particularly interested in how we can use digital technologies to achieve that as well. Through my research and tools like the health literacy editor that our team has developed, I'm also really interested in helping to build the skills of health staff around health literacy across Australia. For me, I'm really passionate about health communication because I do think that good healthcare communication should be business as usual, and it's a really core aspect of delivering safe and effective care. Thank you.
Now the two winners in the category in Sydney. The award for contributing to the growth, maturation and commercialisation of the digital health sector through innovation, leadership, support and advocacy. I have the honour in presenting the next award to CEO and co-founder of CoView Global Proprietary Limited, Dr Sylvia Pfeiffer. Welcome, Sylvia.
It's amazing to see all these women win amazing awards. So thank you, Telstra, for organizing this, and congratulations to everyone. And I'm going to just tell you a little story. Like 10 years ago, when I started working at CSIRO on telehealth, you would talk to people on the street about what you were doing, and you'd say, oh, I work on telehealth technology, and they look at you and go, what is that? Really no understanding by the general person what it is. Only people in the know that were doing telehealth and only into rural and remote areas really knew what it was. Well, the pandemic changed all of that. And I'm really happy that that has happened and that we have been, and at CoView, a big part of that. People now even know, a lot of people have used CoView and have heard the name. So this is a foundational change that we have created. But it's not about that change, it's about what the individual people have gotten out of it. You know, when children in rural and remote areas can get access to speech therapy via telehealth, and that speech therapy is provided in a really high quality level with teleassessments, that's a big difference to their lives. It sets them up for success. Even homeless people with mental health problems can now get their health care on a phone. And busy families that can never find the time to go to the doctor can do telehealth. So telehealth has really become a very common thing in Australia, and I'm very happy that that's been happening. So these are all example uses where CoView is now being used, and I hope that these uses remain and continue to be expanded, as this is just the beginning of a transformation of our industry. My work in CoView has created a foundational change to the use of virtual care in Australia, and that's what I hope my legacy will be. Thank you very much.
Thanks, Sylvia. And another impressive winner in this category I'd like you to recognise the Head of School Computer Science and Engineering at the University of New South Wales, Professor Arkot Somya.
Good evening, and thank you very much to the audience as well as to Telstra Health for having me here and giving this award to not just to myself but to my whole research group. This is over 15 years of work that we have done in this area of medical image analysis and health informatics, developing methods based on mathematics and statistics as well as computer science, what we call AI technology today, right, over a very long period of time. There's a host of students and postdocs behind all these efforts. In terms of what my legacy is, I just want to say a few quick words. I've had a lot of fun. Having started as a mathematics student at university, moved into computer science after that, and I've spent many decades working broadly within the area of AI and computer vision, and I absolutely had a ball working in this specific application area. Why? Because I am all the time working with interdisciplinary experts, subject matter experts, people with clinical and medical backgrounds, of which I have very little knowledge. So I just have picked up a few things and have coasted along, but I do take a lot of pride in my entire group that we have been able to make a small difference. So we build methods, we build software, and we test and implement these methods and make sure that it's useful in real life. So you always collaborate with real doctors, real hospitals, not on toy problems, not on cleaned up data available on the web. Right? That's something that we really pride ourselves on. So in terms of legacy, I would say have fun. I think working in a university, working with young people who are there to learn things and build their careers, I think it's very, very important that they're able to see the impact of whatever they are doing, right? And working in the medical field and working with real experts keeps us really grounded, right? So we know that even if we solve only a small percentage of the problem, it's still going to be useful. So long as we put it into the workflow of the clinicians and work with them hand to hand, it works absolutely fine. On the personal front, I would also say that diversity absolutely works. My teams have always been very, very diverse, with students and postdocs coming from all over the world, and that really does strengthen the work that we do. So thanks to all my postdocs, to all my PhD students over the many, many years who made this possible. Thank you. Some of them are online.
Thanks, Arkot. Congratulations. Thank you, Arkot. Congratulations. And finally, our Judges Award. And you can see what a tough job they had with the quality of all the winners. But the Judges Award recognises outstanding contributions to and achievements in digital health sector. So could I congratulate and welcome to the stage the Institute Director and CEO of Hunter Medical Research Institute, Professor Francis K. Lampkin.
Oh my goodness, thank you so much for this incredible honour. Thank you to Telstra Health, to Elizabeth and to Jess, and to everybody who's turned out to celebrate brilliant women doing absolutely brilliant things. It's amazing that the incredible award winners and the contribution that you've all made here have been recognised like this tonight. You are having such a huge impact and will no doubt continue to have such a huge impact. And I've just loved and been inspired by all of the things you've been talking about tonight. And I truly feel that this style of leadership and impact that you're talking about tonight is what women do best when we're given opportunities and given the support and build the teams around us to make a difference. I'd really like to acknowledge another wonderful person in the audience tonight, Gillian Mason, who is responsible for nominating me for an award for this year. I'm so very grateful, as I am to my wonderful team of collaborators, of students, of co-workers, and my wonderful home team. And I absolutely promise to live up to that person that you've described in that nomination, because we really need help. Our health system and health service needs help, and it needs it now. Actually, it needed it yesterday. And so in thinking about my hope for a legacy that I might be able to leave or create, it's really to have helped carve out a role to create a world where everybody, no matter your background, your gender, your race, your culture, your ability, your location, your access to means, that we all at our fingertips have access to the supports, the connections, the preventions, the treatments, the recoveries, the resources we need to help us live our most full and healthy lives whenever and wherever we need it. And I know that sounds big and far off into the future, but I'm even more excited that this is within reach by listening to everybody in the room here tonight. And that's also what excites me about digital technology, and the reason we're all here tonight particularly, because if we harness that potential in the right way at the right time, we can actually achieve a world just like this. And I think we already are, as many of us tonight have already suggested. So we can do it, and we are doing it. But personally, it's going to take a lot of hunger, a lot of hard work, and a lot of humility to do this, because we actually have to want things to be different. We have to believe that things can be different, and we have to believe that we deserve better and deserve something different for our health and well-being. And we do have to let go of our egos and our legacy ways of working to really build, collaborate and co-design the transformation we need in health. And it is digital technologies and these brilliant women in the room that you've heard from tonight that can help do it. And I think it's going to take a fair bit of good humour to get us there as well, and to keep that optimism and hope alive in the world that we can create together. And so I hope my professional legacy will be that I'm able to be seen as a bit of a catalyst to us achieving this world and creating this world. And I have to say it's especially for mental health, if I'm to be completely honest, which is my background and my passion, but to that world that connects people to what they need when they need it. That there are no gaps and no bottlenecks in any of that need and servicing that need, and where technology wraps around us to keep us safe, included, supported, connected and healthy. And that personally, if I have a personal legacy, it's that people can, if they need to, use my hunger, my tenacity, maybe my humour if they need it, when they can't find their own, to forge their own way in life and their purpose and meaning in life too. So thank you so much for this incredible honour. Good night.
Could I ask everyone to give one more round of applause for all the award recipients tonight? Thank you. You can read about all the achievements and contributions, as well as who inspires our award winners and their legacies, in our awards report on the website. So I'd encourage you to look at it, because we only got a real snapshot of some of the extraordinary work people are doing. So please do so. So it's been an honour to recognise our talented and esteemed winners tonight of the 2023 Brilliant Women in Digital Health Awards. And they too are achieving and demonstrating inspiration to us all. And at the heart of everything everyone said was, thank my team. It's what we should do and what we all do and should continue to do. So we always stand on the shoulders of others. So please continue to engage with us and the connections of the network. And yes, I don't want to stay in the way of arancini balls and champagne outside. So thank you very much for attending.